It is Tuesday, May 19th. Welcome to our daily COVID-19 Task Force update. On the program today, we'll speak to Lisa Westaway and Lloyd Phillips, as we normally do. But we'd like to start things off because it's been announced that June 1st is the date that is being looked at for the reopening of Kahnawake businesses. Now that is tentative, as we've said over and over again, and I'll reiterate, that's the date that is being looked at. In the meantime, a lot of planning has gone into the works to get businesses ready so that they can open those doors safely for not only the consumers, but for the people working within the businesses. So joining us is the Business and Economic Development Officer of the Mohawk Council of Kahnawake, who's been working on the revitalization plan to get things started, and let's bring him onto the program. Welcome along, Paul. How are you?
How you doing, Joe? Good.
Well, let's talk about the plan. I know a heck of a lot of work has gone into it. So, in a nutshell, what's it about?
Yeah. So, pursuant to one of the directives from the task force, I would say maybe three weeks ago, maybe up to a month. A directive was issued to come up with a plan. From an economic perspective, in order to provide that viewpoint to the task force as they were evaluating a potential reopening. As you know, that's kind of through this pandemic, the stage that we were at. If you remember about a month ago, we were pretty much in quarantine, full self-isolation, which you categorize as lockdown. To transition to a reopening, there's economic variables and impacts. And the directive was essentially given to Dewa Dinizakta, who formed a working group composed of members of Dewa Dinizakta, the Labor Office, the PKs, Environmental Health Services, the task force, to really try to find a balanced perspective using a lot of the economic or business that are involved in the community. So back then it was an evaluation of phases. And what we found in the plan was that phases weren't necessarily the best approach, but if you looked at a concept of risk mitigation, which is how you can have businesses and economic activity and essentially a higher volume of interactions of people, then it became easier to apply that for as many sort of businesses as possible according to the public health guidelines. So that's kind of why you see in the first phase, right, the majority of businesses that are able to modify or incorporate different, controls, for lack of a better word, that help mitigate the risk of the virus transmission. According to the public health guidelines, you can see that we're able to, or the plan is to operate in a new normal so that the economy can run while also mitigating the risk of the transmission of the virus. You could keep the virus risk at zero if nobody was ever interacting, doing anything. But moving forward, we have to adjust because there is activity, and in this case, economic activity that's going to take place. And the view we took was how best can you mitigate that risk according to this sort of a model that we put together. And that's really the basis for this economic plan. And the economy, I think everybody has a good understanding of the economy, and that's why you see a lot of these industries that have a high economic impact in terms of jobs, in terms of number of clients, in terms of economic activity and sales are part of phase one, because we really wanted to make sure that a reopening was a true reopening to allow for that economic activity to resume with the public health guidelines in mind. So.
Let's talk about that community support model. Just maybe you can flesh that out a bit.
So the community support model is, the bigger structures that are going to be in place when you think about economic activity or business in the new normal, right? So a reopening doesn't necessarily mean, and actually I don't think it means at all, that we're going to go back to the way business was before. There's different things that are going to have to change that really boil down to, what the business physically looks like. So engineering or physical modifications. You think plexiglass and sanitizer and things like that you see. The second one is that the businesses will need a resource and need to sort of manage employees and customers with the virus in mind in order to essentially what we're trying to do is mitigate the risk of an outbreak as much as we can while allowing for economic activity to occur. So when employees and clients are interacting, owners and managers and even the people, the employees and the clients, should have some signage and some, visible things in the business that would obviously, and people have an understanding that we are in a pandemic. So that's one of the, I guess, the main common guidelines we're looking for across different businesses. And then, of course, the third one is if there's any use of specific PPE equipment, which may not be necessarily the case for everyone. But it all boils down to social distancing, washing your hands, the basic guidelines, but just in a business context.
Mm-hmm. We've already seen a lot of this. I guess most of the businesses that are operating are already doing it for the most part. I would say you have 99% compliance. But for those, especially those businesses who are going to reopen, what should they know about all of this?
So there was a website published, and this was a key piece of information we were relying on in order for a reopening to be successful, and that's what are the common guidelines from a health and public safety perspective that we should abide by and follow, again, to minimize the risk of transmitting the virus. So I'm not an expert in that. Lloyd is not an expert in that. So really we're relying on the task force and their identification of where we're at in terms of pandemic, and then there is some health and public safety factors that they rely on when they're looking at timing. But in terms of how we would proceed forward, the public safety department is involved in terms of helping to communicate those general guidelines which are available online to how they might apply to your specific business and help you plan those. And eventually to verify that those have been put in place so that your risk controls are up to date, right? If you had to make physical modifications, that you have an understanding of who to contact in the event that there's potential COVID-19 case at your place of business, so that you're able to minimize the risk of outbreak. And then on the Lloyd side, they can help facilitate the businesses as clients, right? The businesses in the community, Lloyd is a service provider and your clients to them. So they're going to help you in the context of reopening, including in terms of how that plan may look like, and to help translate those guidelines from very general to how they can fit into your business. And of course, the business owners, I think, already, as you pointed out, have a good idea of what those controls and what to do. It's just a matter of kind of bringing it all together in the community support model, as we say. And then, of course, the task force determining an appropriate date to begin, having the economy function in the new normal. And I guess just to wrap up on that point, there's some things in the context of how we're operating now that may be different. For instance, directives on non-locals, or directives that maybe mention specific industries. So those directives will have to be modified at some point as part of a reopening. But I remember washing your clothes when you get back into your house. Something like that is still a standard guideline that we should all follow. So I think that's kind of what where businesses should look, is this common guideline online, and then public safety is the the department responsible for public safety in a broad context, and in this case for the risk mitigation measures in businesses. And then DEWA can help support the business to get to a place where they're ready to reopen.
Well, let's talk about that support. Can you talk specifically? I know there are different funds being accessed. How's that working out? Are you at liberty to talk about the funding sources?
Well, very generally, for the Economic Relief Fund, and then at the end, in terms of the new normal, there's some economic and financial implications in terms of expectations and what it'll be like. So the Relief Fund is part of an original budget that the council had established, and that was in the context of everything is shut down, people are unemployed as a result of COVID-19, businesses are shuttered or interrupted as a result of COVID-19. So we looked at the budget that was allocated, how much has already been paid out or has gone to individual workers or businesses that are affected. And then we thought about that date of June 1st, potentially in June 1st, the tentative date to, eventually there's going to be a reopening. So how can we modify the funding to support a reopening in the spirit of the guiding principles of the community support model, which is risk mitigation? And then from an economic perspective, how can we support the businesses so that their odds of coming through the pandemic successfully are as high as possible? So the workers are they go to CBS in terms of the relief fund, and the businesses can contact DEWA for, to be served as a client. For the workers at CBS, we're going to have a transitionary measure. If a business reopens and they're hired back to work, there's going to be sort of a 1-week transitionary measure. And then if you return to work and then you subsequently have symptoms of the virus, that you would be able to return for the isolation period and be funded. Because what we want to do is we want to make sure that employees, and of course the owners as well, don't want to face a dilemma of a financial pressure that may result in an individual potentially going to work or not disclosing that they have symptoms. So this is kind of a way of supporting the model, at least in the period of reopening, that if you go to work and 1 or 2 weeks into it, you present with symptoms, that you have a resource to support you in the isolation period at a minimum. Again, with the idea of keeping an outbreak to a minimum, right? So having somebody not go to work because they feel symptoms is a critical piece of preventing an outbreak, and we wanted to help support that. For the businesses, we have 3 sort of areas. One is the business interruption funding will continue for 1 month of reopening. So that's the existing kind of funding. Previously, it was if you were closed or if you were essential operation. So if you're in if you reopen for the first month during this reopening, you'll still be eligible for the business interruption assistance. So the second one is the fit up of the actual physical infrastructure. And we're not talking about, in most cases, I don't think we're talking about a very large bank-breaking investment, but we want to support it specifically, with our mantra of businesses that are most vulnerable, smaller and medium-sized businesses, trying to support them the most. We want to fund the COVID-19 fit up to the physical business. Some examples, plexiglass, hand sanitizer dispenser, signage in terms of, what are the public health guidelines, the stickers on the floor, whatever we can do so that the entirety of the economy and as many businesses as possible are reopened with those fit up in terms of risk mitigation, engineering controls as possible, again, to minimize the potential for an outbreak and the spread of the virus by containing each individual sort of economic interaction. And finally, with the NISACTA, you can inquire about looking at your working capital needs as part of a reopen. So I don't know the individual positions of the businesses, same as, I don't know the individual situations of the workers. But if you face a dilemma from a reopening due to a working capital issue, that's an area we're evaluating as well, that you can, as part of contacting DEWA NISACTA, there's the business interruption, there's the COVID-19 fit-up funding, and then you can inquire about working capital funding as well. And then at CBS, if you're going to be returning to work as part of a reopening, that'll be part of the dialogue you can have with them between the worker and CBS.
Obviously, a heck of a lot of work went into this, and I'd just like to say thanks on behalf of everybody for you and your team doing all of this work. Any last thoughts, Paul, before you head off?
Yeah, real quick. I guess it's, first of all, it's not, I guess, our team, right? It is a team. I'm part of facilitating. My role at the Council of Business and Economic Development Officer supports the Economic Development Portfolio Chiefs. So that's Gina, Mike, and Frank. And obviously they're involved in the relief fund as well as the reopening, and collaboration with DEWA NISACTA is also involved. So really there's a lot of people involved. And I know the staff at CBS and DEWA NISACTA as well have been particularly integral in signing up the 900 inquiries at CBS and signing up the 150 plus inquiries at DEWA. So they really make it all happen. And I guess finally it's just that the new normal and how we operate is kind of, following the public guidelines, mitigating the risk of the virus. Each of the, employees, customers, business owners, and, community members within the economy are all responsible for that mitigation of the virus transmission and making sure it doesn't spread through economic activity, basically. So we'll see with the tentative date of June 1st, right? We're in the process of preparing for that tentative date, and you'll see the directives changing, as we get closer to that date as well. So.
All right, Paul Rice, thank you very, very much for taking time to talk to us today.
No problem. Thank you very much.
All right, take care. All right, we'll get to the regular part of our updates, and joining us from the Kahnawake Memorial Hospital Center is the Executive Director, Lisa Westaway. Lisa?
Thanks. So Paul used the word the new normal quite a bit in his discussion, and I actually would like to use that same terminology because we're going to be discussing that a little bit today. And this is all part of getting prepared for the reopening of business. What are exactly the expectations that we all have on us as individuals in order to ensure the safety of the collective? So in order to ensure the safety of our community, we all have a responsibility. We've spoken a little bit over the last couple of weeks of how we observe loosening up of measures pretty much coming with the nice weather. And it's really important for us to discuss this a little bit as we move towards reopening of business and what the possible impacts of those loosening up of those measures can be. I'm going to refer a little bit to the elements of success that are required in order to reopen business successfully. So the first one is that we stay home when we're sick. So you can see through the support model for reopening of business that we really put a lot of emphasis on this. And Paul mentioned it in the financial support that will be available because we really want to ensure that people do not work when they're sick. Another element is that we increase testing, or we make sure to have testing available. So for this reason, we've extended the rental of the tents for the testing site, and we will maintain our testing site in place for the time that we need it. So that's been extended as well. We also want to ensure that hygiene measures are being respected. So this means washing your hands. So if you listen to Dr. Gauthier time and time again, she expressed how we limit the transmission of the virus, or how much we decrease transmission of any virus the more we wash our hands during the day. So that's really important. Of course, sneezing into your elbow, throwing out your used Kleenex, all of those things are really important. Cleaning, cleaning often touch surfaces. And the last element is social distancing. So maintaining our physical distance one from the other, that 2 meters or the 6 feet, is especially important in order to ensure a safe reopening of business. And so it's not the time to put in place a reduction in those measures, or what we see happening around us in different provinces or countries is loosening up on social contact measures by increasing the amount of people that we can have in small gatherings, or putting in place concepts such as double bubbles. Those are being put in place in areas that are more advanced than we are in presently. Those are being put in place in areas where there is already business opening and where they already have control over what's happening within their community. So we are not yet in that position, and there is a gradual theoretical phase approach that we have to take in order to have a little bit of control as we reopen business. So one of the questions that I see often, and it's a good question, is why are we reopening business but not increasing our social contacts? This doesn't make sense to me. And you're absolutely right. In a humane point of view and our normal everyday lives, it really doesn't make sense. We're looking at reopening business while we still have risk. And again, I want to just talk about this new normal. The idea of the new normal is that at some point we have to get back to some semblance of normalcy. It's not going to be the normal that we had before, but by not moving towards reopening of business, there are many other impacts that are social as well on our community. So it has to do with mental health, depression, addictions issues. It has to do also with food security. These are just a few elements that are impacted by this continuous state that we find ourselves in right now. And it's always a balance about how we move forward, in what capacity, at what speed. And so we try to move forward while maintaining some semblance of control, and the social distancing is the element that we have most control over, each of us as an individual, and that will have the most impact on the success as we move forward. And so we are not ready to move towards decreasing measures in place regarding social distancing. That needs to be maintained, and it's really important that each of us take that responsibility. As we move forward, there's not going to be, the task force will not be able to control everything that happens. Reopening business brings about 15 to 30% increase already in social contacts. If we look as of the 25th, all the businesses that will start to open up around us, we can already estimate that that will definitely be the case. If we don't control our social distancing, then we're increasing our social contacts even more, therefore having less of a chance of controlling the transmission of the virus. And so again, this is all happening in phases, and when we are ready to look at the social distancing and trying to maybe open that up a little bit, we will be able to let you know. So if we look at phases, we're still looking at June 1st as the tentative date to reopen business. Of course, we continue to evaluate that as we move forward, but the next phase will be looking at the social contacts, and that's once we've established that the reopening of businesses has not had a detrimental effect on our community. And how will we do that? Well, we've already started with the community health check. We will be giving you results of that community health check this week, probably tomorrow or Thursday. And that will be used as indicators and as a measure to re-evaluate after we start to open business, to be able to compare the before and after to see what the impact has been on our community and can we move on to next steps. So we're really trying to do this with some scientific basis. Again, as we've spoken about in the past, we're looking at what's happening around us, both within our own province and outside of our province, and to other European countries who have started this process of the phased approach. And we're going to keep you posted as we go along to make sure that you have all the information so that it's a little bit easier to understand the reasoning behind the decisions that we're making. But again, I just want to reassure the community that these decisions that we make are based on science, are based on fact, are based on the indicators that we choose to allow us to make decisions about how we move forward. So another point that I think is really important and another reason to keep in place the measures for physical distancing is actually the age of our community members. So we looked today a little bit at the breakdown of age groups within the community, and of a population of approximately 8,500 people, there are 2,034 people who are 60 and up. So that's 24% of our community that is at an age that is vulnerable. So we're not just talking about residents at KMHC, at the Elders Lodge or ILC. We're talking about a huge group of people who are more vulnerable to getting, not just to getting the virus, but of becoming seriously ill or to die from the virus. And therefore, as we move forward, we need to really do this slowly, taking all precautions, and all of us taking on the responsibility that we have as individuals so that we can minimize the risk as much as possible. So I'm going to switch a little bit to KMHC in particular now. So that was more, global task force information, but we'll speak more about KMHC. And again, speaking about the new normal. So as we move forward with reopening of business, or looking at what our new normal is going to be like for the next year or so, we have to start doing that at the hospital as well. So one thing that we started looking at is our outpatient services. So we're functioning mostly by essential services right now, and in doing so, I've well, we've tried to look at a comparison with last year. So if we talk about outpatient services, for example, how many visits did we have last year, both physicians and nursing, versus this year? And what we've discovered is that we're at about 70% of our functioning from last year. So that was surprising to us. We thought that it would be much lower, but we see that we've mitigated that, the impact of COVID-19 quite a bit, and we still are at 70% of services. Either we may be giving services differently, so it could be over the phone, it could be by iPad, so it's very different than how it was last year, but we're still seeing patients. So I just want to remind you that if you are not well, if you have any medical issues, that you please call KMHC and we will arrange either for you to be seen or for you to receive a phone call. So medical services are still being provided. But areas that have not been provided since the beginning of all this, so early March, is optometry services, ophthalmology, dentistry. So all of these specialists have orders, and those orders are in the process of issuing directives that would allow them to slowly come back to work. So I just wanted to keep you up to date with the fact that we're looking at those directives right now, how we can implement them at KMHC so that shortly we can reopen those services as well. So we'll keep you posted on when that will be, but it's in the process of being worked on. So I think that's the last of my update for now. Again, tomorrow or Thursday, I'll be providing you with results from the health check and explaining in a little bit more detail how we're going to use that in the future to help us have objective measures to be able to make decisions about the impacts of reopening of business. And again, a reminder that we all have an individual responsibility as we move forward to social distance, to wash our hands, and to stay home when we're sick. Thanks.
Thank you very, very much, Lisa. And joining us for his first update of the week after the long weekend is our Commissioner of Public Safety, Lloyd Phillips. Lloyd.
Thank you, Joe. Thank you, Paul, for that great update on the latest developments from the economic front and also from the community-based services. I'm very satisfied with the work that has been done, given the mandate and the directive issued by the task force. I think that our whole team here, would congratulate, the hard work that's been done over a very short period of time. And obviously, we know we're not through this yet, but certainly we see that the economic release package and support for a community is evolving as the pandemic evolves as well. Just keep along the same lines initially what Lisa was just talking about. We did see today, or this weekend, it was formally announced by Premier Legault that the Greater Montreal area is going to start reopening businesses on the 25th of May. And obviously, that will have an impact on our community as a whole. We don't live in a bubble. We don't live in an island. So whatever happens around our community, has some impacts on us. Inevitably, if more businesses open up in Montreal and surrounding areas, our people are going to venture out and want to do some shopping or do some exploring just to get out of the house and stuff. Which again is a normal process. It's a normal evolution, and the way that things are progressing here, with the pandemic. But with that, and similar to what was mentioned, with that evolution, comes a higher risk. No matter what we do in terms of a task force, we can never get that risk down to zero. But what we need to do now is start focusing on what you could do again as an individual. We can't really control what happens external to Kahnawake. As the business evolves and open up in their community, there's less and less control mechanisms in place. But one thing you can control, and it goes along the lines of having over 2,000 people, 60 years and over, in our community, which are many, many households. Is that's where your individual home has that ability to control what happens in your home, who has access to your home, who has access to your property, and what measures that you could put up to protect yourself or to protect your loved ones who are in that vulnerable population. So I mean, that is evolution that we're looking towards the community to say you have to take on this responsibility. And sure, we'll provide guidance, we'll provide recommendations to you on how to best do that. But that's something that we're gonna assist to the extent possible to every individual in the community. Because everybody does want to have that new sense of normalcy over the next coming weeks and months, and we want to move down that path along with you, but again, as safely as we possibly can. So some of those things I think are worth repeating, because as a collective, we have been doing an excellent job in terms of the response to the pandemic in our community. And moving forward, we want to see that cooperation, we want to see that vigilance that our community had put forward over the next while as we evolve into the business openings in the community, but as well as what's happening around Kahnawake. So that's important to keep that in mind. Maybe just a couple of notes on that. Some of the ideas that we're bouncing around, some little tidbits of information that maybe you can implement yourself. As Dr. Gocher spoke about this weekend about hand washing, and something that we've been saying time and time again, the more frequently that you wash your hands, the possibility of transmission to the virus decreases. So something as simple as setting a timer on your phone. Most people carry a phone nowadays, or iWatch or iPhone or whatever device you have. For every hour or so, it rings, it beeps, and that's a reminder. Okay, now it's been an hour. Let me get up and let me go wash my hands and go back to work or go back to whatever you were doing. At the very least, use your hand sanitizer. But keep in mind, washing hands is still just as effective, if not more effective, if you do it properly. That whole minimum of 20 seconds of washing your hands. So if you set a timer to remind yourself, all right, it's been an hour, like I said, then you go wash your hands. It's a good way just to get into the proper habit of doing that, and make it get into the mindset of individuals. One other maybe tidbit we talked about as well is because as business progresses and as the pandemic goes forward, there will be the inevitable more interaction. With as Lisa mentioned, 15 to 30% more interaction with people just because of business opening. And eventually, as the social restrictions ease, there'll be more restrictions. So it would be good to get into a habit of and maybe at the end of the day, if you take a note, either again in your iPhone or whatever device you have, or even on a piece of paper, write down at the end of the day, who have I been in contact with today? Not just maybe somebody passing the hall, but like if you sat down and had a conversation with somebody no longer than 10 minutes, you're in their general presence with this person or persons, and then take note of that. That way, at the end of the day, you have a running list of who you've been in contact with. That way, in the future, if yourself or somebody within that circle turns out to be positive, it'd be much more easier for people to trace back who have you been in contact with over a period of time. And that would help expedite informing people that they may have been exposed. It expedite the process of isolating individuals, and obviously help drastically reduce the possibility of further spread. So maybe those little things that we could keep repeating these messages, that you can start doing that on a daily basis. It'll help yourself and obviously help public health initiatives in the event that there is more positive cases happening in the community. Maybe on a slightly different note, I just want to make reference to the fact that today there was a official council meeting, and I had requested to the council for a renewal of the state of emergency, to maintain the current measures that are in place, and the directives that are in place, and the mandate, more importantly, of the task force, and that was unanimously passed by Chief and Council. So basically, the mandate that was passed 1 month ago goes in 30-day intervals according to the Kahnawake Emergency Preparedness Law, and so that was again unanimously decided to extend the mandate of the COVID task force for additional 30 days with the same mandate that currently exists. Again, I'm very appreciative of that, the support shown by Chief and Council for the task force and the work that is being done. This is not something that was not anticipated. A month ago or so, we were looking at where we'll be in 30 days, and we kind of assumed we would need that renewal, but now we're at that point where it has to be renewed again. Where we are in 30 days from now, do we have to maintain the state of emergency? Do we have to modify that in any way? Again, those are question marks that we'll see in the weeks to come, but the existing mandate does exist for the next 30 days. So, that's a good indicator maybe to the community, to saying that, as much as we talk about moving forward and developing and evolving, that we're definitely in this for the long haul. And as you've seen that what Paul had presented to you, there are plans, longer-term support for businesses, individuals who may get sick, who are on the work site. There is support mechanisms there for them. So again, collectively as a community, individual responsibility of a task force, and the responsibility of the organizations is going to continue to evolve. It's going to evolve in a way that we want to ensure that is unified as we possibly can get, again, to minimize the spread of any virus in the community and keep our community as safe as we possibly can. So with that, Kahnawake, there's a task force meeting tomorrow, and I'll be here tomorrow to give you an update on that. Thank you very much.
Thanks so much, Lloyd. And both Lloyd and Lisa made reference to the population of those 60 and over. And if you didn't see yesterday's update, we welcome you to go into the archive and check it out, because we spoke to two elders to get their perspectives. Very interesting interviews with Joe Jacobs and Leonard Bordeaux. I think if you haven't seen them, you really should see them. Just a couple of notes. Paul Rice gave an excellent presentation earlier. And as we've said on other updates, if you want to look at those guidelines, the whole reopening for business document, it is available at covid-19.kmhc.ca/for-business. And finally, before we leave, just a note, if you're watching this on Paul's cable, usually we run a bunch of different programs in sequence, and one of them is the instructions on Indian day schools. So that is coming off the rotation, so to speak. But if you want to take a look at that and need to get some information on how to fill out your paperwork, by all means check out kahnawake.com/Indian Day School. So there you go. That'll wrap it up for us. We'd like to thank Paul Rice, Lisa Westaway, and Lloyd Phillips, and we'd like to thank you for joining us today. Take care. We shall see you tomorrow. Remember, stay clean, stay apart, and if you're not feeling well, stay home.